So all of these muscles that relate the shoulder blade to the spine need to be treated. You can see the high tone in the lower trapezius, picking up here, and then a bunch of taut fibers. You can see them strumming. And then underneath them, we've got the rhomboids. And up in the superior medial angle, the scapula, is the levator scapula. So on the surface, the upper traps, but then this material that I'm flipping on underneath the upper traps is the levator scapula attachment. So let's just work on that business for a minute. Okay, so this is lower trapezius work, followed by a little bit of stretch. Rhomboid work. All around the origins, off the spine. Things are thick going here. It's going to take a little bit of time to work our way into that business. If I'm ricocheting off, I might take the distal attachment of the rhomboids and strum in there to drop the tone a little bit, and then return proximally to the attachments off the spine. Sometimes that makes them a little bit more enthusiastic. Then around the top margin of the scapula, the tight muscle in here is the levator. Let's treat the upper trapezius first that overlies it. You can see I'm flicking over the levator when I'm doing the upper traps. The upper trapezius goes all the way up to the base of the skull, so we need to spend a little bit of time up there. Now, the upper trapezius is important to treat when you want to have access to the supraspinatus, because the supraspinatus underlies it through here. So a supraspinatus treatment will involve normalizing the texture in the upper trapezius, dropping the tone, and getting a bit of length in it. Now the traps are coming down in tone. We need to focus a little bit on the levator scapula attachment. So I'm reaching through the middle trapezius and hooking into the inferior margin of the levator scapula. I think I'm going to try to make my two thumbs meet each other in the meat of the superior medial angle of the scapula. It's important that both therapist and client are relaxed when we do this. That's very nice. If you find the client is not being permeable to this manipulation, then the first thing to check is that you're relaxed, that your shoulders soften, that your hands soften. And take a deep breath. Once the therapist relaxes, the client's often more permeable. If they're still a little reluctant, then I ask them to take a slightly deeper breath. Take a slightly deeper breath, please. As they breathe in, it tenses up, and as they exhale, the tone often falls a little bit. So I encourage that drop in tone. Sometimes I use a little bad Italian. I say molto bene when the tone drops, to help them recognize that whatever they did with their body-mind was effective at dropping the tone. So we're just proceeding in a workmanlike fashion through the attachment of the levator scapula. It's important to think about it. The muscle's braided, the bands of it actually wrap around each other, so it's actually capable of choking itself through tension. So when that happens, the ground substance changes and becomes very viscous. It's like you spilt molasses in the muscle and then it dried up in the summer sun. So if you had braids of hair that had molasses in them and then it all dried up, you're not going to get the molasses out by stretching the hair. You're going to get the molasses out by picking up the braids, heating them, and then rolling them on each other, melting and working the molasses into a softer type of substance. And then as that happens, then you can work in a longitudinal sense through the fibers themselves. And these fibers go right up to attach onto the top 4 cervical vertebrae on their transverse processes on the side here. So this would be the top attachment. It's C1 of Levator Scapula. So that's very tight here. It's creating a bit of compression in the neck. So we're just going to strum that, see if the tone will drop. As the tone drops a bit, then you can see I'm tractioning the head slightly to get a bit of length in there. And then we work our way in a nice workman-like fashion down the neck a ways for C2 and 3 and 4. Strumming and dropping the tone on the attachments of the levator, which is also it's a triple attachment. So at the front it's the middle scalene, and then there's levator and splenius cervicis attaching. So sometimes you're not sure which ones you're on. That's fine. So you want all that to be nice and soft and mobile. And as that happens, then you traction the neck a little bit. Make sure your face cradle's secure. You don't want to push anyone's head down towards the floor. So we've done a nice job at this end. Then we make sure that that softening translates all the way down to the superior medial angle of the scapula. So we could do a bit more work here, but that's a good push in the right direction. Very often if you make some nice changes and you get 30-40% of the job done with your hands, then the body's inertia shifts and the person continues to improve after the treatment, especially if they're enjoying the change and they're really using their neck and shoulder in a much happier, more full way. A little bit of self-stretching by them can go a long ways as well.